Cardiovascular disease, CVD, overview. Cardiovascular disease, CVD, is a broad term for conditions that affect the heart and blood vessels. It includes diseases such as coronary artery disease, heart failure, stroke, and hypertension. CVD is the leading cause of death worldwide, but many cases are preventable through lifestyle changes and medical management. Types of cardiovascular diseases. 1. Coronary artery disease, CAD, caused by the buildup of plaque, atherosclerosis, in the arteries, reducing blood flow to the heart. Can lead to angina, chest pain, and heart attacks. 2. Hypertension, high blood pressure. Chronic high blood pressure increases strain on the heart and arteries. A major risk factor for heart attacks, strokes, and kidney disease. 3. Heart failure. The heart cannot pump blood efficiently, leading to fluid buildup in the lungs and body. Symptoms include fatigue, swelling, and shortness of breath. 4. Stroke. A blockage, ischemic stroke, or bleeding, hemorrhagic stroke, in the brain's blood vessels. Can cause paralysis, speech difficulties, and cognitive impairment. 5. Arrhythmias, irregular heartbeat. Abnormal heart rhythms like atrial fibrillation, AFib, can lead to stroke or heart failure. Symptoms may include palpitations, dizziness, or fainting. 6. Peripheral artery disease, PAD. Narrowing of blood vessels in the limbs, leading to pain, numbness, or reduced mobility. Can increase the risk of heart attacks and strokes. 7. Congenital heart disease. Structural heart defects present at birth. May require surgical intervention or lifelong monitoring. 8. Cardiomyopathy. Disease of the heart muscle that affects its ability to pump blood. Can lead to heart failure over time. 9. Rheumatic heart disease. Damage to heart valves caused by untreated streptococcal infections, rheumatic fever. Preventable with early antibiotic treatment. Causes and risk factors. 1. Modifiable risk factors can be controlled. Unhealthy diet, high in saturated fats, salt, and processed foods. Physical inactivity. Lack of exercise weakens the heart and increases obesity risk. Smoking damages blood vessels, increases blood pressure, and raises heart attack risk. Excessive alcohol consumption can lead to high blood pressure and heart failure. Obesity increases strain on the heart and raises cholesterol and diabetes risk. Diabetes. High blood sugar damages arteries and increases heart disease risk. Stress. Chronic stress can elevate blood pressure and lead to unhealthy habits. 2. Non-modifiable risk factors cannot be controlled. Age. Risk increases with age, especially after 45 for men and 55 for women. Family history. Genetics can predispose individuals to CVD. Gender. Men have a higher risk at an earlier age, while women's risk increases after menopause. Ethnicity. Some populations, e.g., African, South Asian descent, have a higher risk. Symptoms of cardiovascular disease. Symptoms vary depending on the type of CVD, but may include chest pain or discomfort, angina, shortness of breath, fatigue and weakness, irregular heartbeat, palpitations, dizziness or fainting, swelling in legs, feet, or abdomen, sudden weakness or numbness, sign of stroke. Diagnosis of cardiovascular disease. 1. Physical examination and medical history. Blood pressure, cholesterol levels, weight, and lifestyle habits are assessed. 2. Diagnostic tests. Electrocardiogram, ECG/EKG measures heart rhythm and electrical activity. Echocardiogram uses ultrasound to assess heart structure and function. Stress test monitors heart function during exercise. Blood tests checks cholesterol, blood sugar, and markers of heart damage. Coronary angiography uses contrast dye and X-rays to examine blocked arteries. MRI or CT scan provides detailed images of the heart and blood vessels. Treatment and management. 1. Lifestyle changes. Healthy diet. Eat fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise. At least 150 minutes of moderate exercise per week. Quit smoking. Reduces heart attack and stroke risk. Limit alcohol. No more than 1 drink per day for women, 2 for men. Weight management. Maintain a healthy BMI. Stress reduction, meditation, yoga, and relaxation techniques can help. 2. Medications. Blood pressure medications, ACE inhibitors, beta blockers, or diuretics. Cholesterol-lowering drugs. Statins reduce LDL, bad cholesterol. Blood thinners, aspirin or anticoagulants to prevent clotting. Diabetes medications. Control blood sugar levels to reduce heart disease risk. 3. Surgical and interventional treatments. Angioplasty and stent placement. Opens blocked arteries using a balloon and stent. Bypass surgery. Creates a new pathway for blood flow around blocked arteries. Pacemakers or defibrillators. Regulate heart rhythm for arrhythmia patients. Heart transplant. Last resort option for severe heart failure. Prevention of cardiovascular disease. 1. Routine health screenings. Regular checkups to monitor blood pressure, cholesterol, and diabetes. 2. Adopt a heart-healthy diet. Mediterranean or DASH diet recommended. 3. Exercise regularly. Help strengthen the heart and control weight. 4. Avoid smoking and excess alcohol. 5. Manage stress. Engage in relaxing activities and get enough sleep. When to see a doctor. Chest pain, especially with exertion. Sudden shortness of breath. Severe dizziness or fainting. Numbness or weakness on one side of the body. Palpitations or irregular heartbeat. Emergency signs of a heart attack. Chest pain or discomfort, pressure, squeezing, or fullness. Pain radiating to the arm, neck, jaw, or back. Shortness of breath. Nausea, sweating, or lightheadedness. Call emergency services immediately if you or someone else experiences these symptoms. Conclusion. Cardiovascular disease is a leading cause of death, but is largely preventable through healthy lifestyle choices and early medical intervention. Regular checkups, maintaining an active lifestyle, and managing risk factors can significantly reduce the chances of developing heart disease. Would you like more details on a specific type of cardiovascular disease or tips for heart-healthy living?